All right, guys, thanks so much for listening to the CX Chronicles podcast. Super excited for today's show. We have a super dear old friend of mine that I grew up with. Dr. Daryl Connolly is joining the show. Daryl, say hello to the CX Nation, sir.
Hey, Adrian. Pleasure to be here. Thanks for having me, man. We go way back. It's good to be here joining you on the podcast. Appreciate it, man.
100%. So, guys, this year we've been trying to do a bunch of different shows, and we're trying to show all of these different facets of different types of industries, different types of business spaces, different types of customer-focused business leaders, right? We spent a lot of time talking about technology and startups and scale-ups. Daryl is going to talk with us today about the wonderful, wild world of healthcare, and we're going to get a totally different lens. We talk about customer experience on a regular basis, and Daryl called me up one day. He's like, dude, why don't you talk about patient experience, man? It's some of these things that you're talking about, some of these things that you guys are always trying to shine a light on. He's like, Adrian, it fits inside of my world, man. Every single day of working with patients, working with other doctors, working with other healthcare providers, working with all the granularities and intricacies that come inside of the healthcare space. So today I'm pumped. Daryl's going to walk us through that, and we're going to get a whole different look at the 4 CX pillars from a doctor's point of view and from a healthcare point of view.
Awesome. Yeah, should be fun. Man.
Daryl, why don't you start off the show, brother? Give the CX Nation, take a couple minutes, introduce yourself, give your background, and set the stage for what we're going to jump into today.
Sure. Yeah, of course, man. So, I was always kind of interested in medicine, going way back, just a really fun, exciting, ever-changing kind of field. It's, you go into work every day, you don't know what you're going to see, so that it just kind of really keeps things interesting, keeps things fresh. So I had, I completed my college up at University of Buffalo there, grew up in Buffalo for a while, ended up going down to med school in the Caribbean, actually. I went to University of Saba.
It was a wise decision, Daryl, to leave the country and get down south.
Wonderful decision. Yeah. Right in the heart of January was the first semester. Just very smart. Yeah.
Smart man.
Graduated down there and then got in some residencies, fellowships. And currently I am working at Geisinger Healthcare Institute in Northeastern Pennsylvania. So I am a pulmonary and critical care provider, but recently, just within the last year or so, I'd also taken over for the director of our pulmonary function lab. So we do all the kind of different exercise testing, breathing testing, some things like that. So I had taken over that aspect of things as well. And so everything I say here is really just it has nothing to do with Geisinger. Everything is really personal, my own. Doesn't represent any Geisinger or organization. It's really just sort of all the different healthcare institutions I've been at over the years of training and how the healthcare field is run. And you're right, there's so many similarities with the crossover and listen, healthcare is a business.
It's a huge business.
Yeah, we provide a service, and our patients are our customers, and we have to not only do we have to do a good job in providing that healthcare to them, but we have to leave them happy. They're not going to come back, or they're not going to see us again, or they're not going to even more than that, they're not going to trust us, right? If we don't build rapport with them, if we don't able to communicate with them effectively, you lose trust there, and that's really the foundation moving forward for developing that relationship and getting people better.
Yep. No, you're spot on, man. Number one, it is a massive business. It's a huge part of our global economy. The other thing too is you're right, man, where this is one of the most a patient experience, or taking care of a loved one or somebody that's sick or somebody that's going through some trouble. That's arguably one of the most difficult types of things to go through in life. Nobody wants to hear when a friend or a family or a loved one is sick or has to go to the hospital or has to go and get treatment for whatever. It's a super emotional type of place, which brings, I would argue, and Daryl, you're probably going to get into this, brings the stakes up a lot higher. Many of the folks that we have on our show, they're incredible customer focused business leaders, and they're thinking about all these cool products and all these cool services and doing all these cool things with their teams. And as incredible as that is, at the end of the day, business, there are more important things in life than business, right? And then like growing your business, growing your team. When you start to talk about the medical space and you start talking about the healthcare space, we're talking about people's lives. The stakes are higher. The complexities are a lot higher as far as regulation, just what goes into it. Daryl, you were telling me the other day just about some of the wild things that are going on, just in terms of constantly expanding new spaces of focus and having new areas of the healthcare system working together to try to figure out how you can push things even further along. So it's really a cool a cool space to get into. Daryl, I'd love to
Absolutely.
kind of go ahead, sir. Go ahead.
No, and that's where, listen, we are, the healthcare field is considered, a sort of a high reliability organization, right? And so there's, essentially what that means is it's sort of a company that, essentially has people's lives at stake, right? Where you really need to be performing at a high level consistently, because if there are, if there is any, wasted time, especially any errors, right, that could be fatal, right? And so, obviously there's still a push, always for improving, medicine, but the focus on preventing those errors, preventing bad outcomes and things that we can change to have better patient care is huge. Another field like that we kind of compare it to sometimes is like the airline industry, right? If they make a mistake at 25,000 feet, right? That's you don't have a whole lot of wiggle room up there, right? And so obviously we heard what happened in Denver recently, that see the engine on the ground there.
This week alone, we've got a huge example of what happens when in a specific types of industries, when safety becomes an issue, or better yet, you have an accident like this that affects a bunch of people's lives. You got to really pump the brakes and think about what's going on with that.
Yep. And so you really have to be sort of at the top of your game all the time, or else people could die. And that's where I think it's nice in the healthcare field, because it's everybody's goal, right? Everybody's on the same page, everybody's on the same team. We say, listen, our goal is to help, these patients that come in, whether it's the inpatient world or the outpatient world, they're coming to you for a reason, right? And everybody's on the same page. Everybody has the same goal, trying to get them better, trying to improve, their symptoms or their illness or whatever it may be. And that makes it a really good environment to work in when everybody's trying to click on all cylinders like that.
I love that, Daryl. I think, it sets us up perfectly let's jump into the first CX pillar team. I'd love for you to just spend a couple minutes. Daryl, you've been in all of these different organizations. You've even, through your time in residency and then coming up into your current specialty, you've seen all of these different types of teams and types of departments in different hospitals and different healthcare organizations. Can you spend a couple minutes talking about the first CX pillar team? What are some of the things, Daryl, that kind of jump out at you, or some of the things that you've seen along your own journey that have really kind of stuck with you when it comes to having a strong team, having an organized team, understanding who does what? Spend a couple minutes talking about team in the healthcare world.
Of course, yeah, and that really that was something that got me interested in the intensive care unit. When I first started training, I really went into sort of just general, kind of internal medicine my first few years after getting my MD degree, and it was really the ICU that kind of spoke to me in that sense, because one, it's sort of the sickest level of patients that you can have, but everybody on the team is just so sharp and so understanding of what their roles are. And so I think that's kind of what drove me to the ICU, is because we talk about that, there's really no room for error, but especially in the ICU, when those patients are that sick, everybody's got to be on point. And I've been very lucky to have just a wonderful team where I'm working right now, and have had many great places that I've worked. But it's not just me, right? It's absolutely, there's no way that I could do my job without everybody else being on point as well. Obviously, everybody knows nurses in the hospital and the importance that they run with patient care, and right at the bedside with everything there. So the nurses play an integral role, the biggest part of taking care of patients with everything. We have, but it's a whole tree that comes down, right? It's not only the nursing side of things and the physician side of things, right? There, you need physical therapists, occupational therapists, speech therapists to get patients up walking, up speaking, up, improving and rehabbing, to be able to get them out of the hospital and move forward and things, right? You need nutritionists to sit there and help you with, how are we going to manage this patient's, calorie intake, and in order for them to heal and get better with all that. You've got respiratory therapists helping us with the ventilators in the ICU. You've got mid-level providers and residents and students and everybody else that play an integral role with everything. And so it's been really interesting to see that transition, because everywhere you go, it's that same team process, regardless of what hospital you're at or where you are. On the ICU side of things, the inpatient side of things, I think the roles and responsibilities are really laid out very well. And it's not not always easy to work as a perfect unit with everything. You're going to have interpersonal problems, and
Sure,
it's
of
a
course.
stressful environment, right?
Yeah,
It's
absolutely. I
it's a
can't
very
even
high
imagine.
stress environment. Yeah. So it's going to be hard sometimes, but I'm lucky to have a great group of people around me right now with everything. It's a great organization right now, and so I'm very blessed to be where I am, and being able to take care of people that way.
It's funny, Dara. I love like the picture that I have in my head right now. I'm thinking about an ICU. I'm thinking about all of this stuff going on, people moving around, like to your point, really sick people coming and going and flying through the room. And then I'm trying to like take a few steps back and think about some of my experiences working in all of these venture capital backed startups. And I'm thinking, man, as high as the stress or as high as the tension or as high as some of the temperatures can get in these startups, I'm thinking, there's no way it compares to an ICU on a Friday night when you got all these different things popping off, all these different things happening. It's really interesting to kind of hear you sort of lay that stage. I think it's for our listeners. I mean, just take a moment to pause and think about that. The next time that you've got some huge blow up with your biggest customer, or the next time that you've got some big friction fueled argument with one of your teammates or one of your collaborators, just stop to take a minute to think about what some of the healthcare professionals out there go through every single day of the week, right? Every single day. And then more importantly, Daryl, this last year with COVID-19, with the pandemic, with what the entire world has gone through together, that takes what we're talking about right here to an extremely different level. Can you spend a little bit of time talking about what has that extra toll, or what has that extra demand, or what has all of these complexities that we've all been watching together for last year? What's that done for some of the teams in these different healthcare organizations?
Yeah, so it's stressed everybody. Clearly, not only from obviously the infectious disease standpoint, right? We were all worried, especially at the beginning, that listen, this is a new virus. This is something that's killing people left and right. Are we going to be next, right? And so that was the initial stress, just kind of coming into work, seeing
Sure.
these people with COVID-19, with this infection. So that's kind of the initial stress that goes on. But beyond that, it's and obviously we're seeing the numbers, and the unfortunate toll that we just passed, this half
Oh, so
million
sad, man. So
American
sad.
lives, which is just awful. But that half million people, right? There's much more that have gotten the illness and recovered.
Sure.
And
Yeah,
so not only do we have, all of the regular patients, listen, heart attacks don't stop during COVID-19, right? Strokes don't
totally.
stop during COVID-19.
Totally.
So we're still seeing all of our usual sort of, patients that come in with critical illness, but now we're just adding this extra, layer, this extra, disease on top of it. And these patients, unfortunately are very, very sick when they come in. And so not only are you stressing sort of the environment that you're working in, right? We're using additional, personal protective equipment.
Sure.
There's additional gowning and gloving that goes on with these patients, transport, right? All these different things that go into it. But now you're sort of just running on the red the whole time, right? Our ICU numbers have been, 90+% capacity for a period of time now. Right now, thankfully, that's coming down. But when you're full to the brim with everything, you're stressing, all those resources that you have. And everybody feels it, right? And so everybody feels it. Everybody's stressed out, and it's tough too, because what can you do to get your team some break, especially when there's no end in sight, right? And so it's been a year now, right? Nobody knew
Yep.
how long this would last, but I think the vaccine has offered some obvious promise for us, and getting people vaccinated, and with some of the measures and the numbers coming down, that's all wonderful, and we look forward to that. But I think there's a lot of things, especially that you have to take care of yourself, right? You have to take care of your team, and we can't provide good level of care if we're not getting some breaks and resolves well. And so I think it's been great. Our organization has provided a lot of resources to staff members, people, training, both online resources, mobile app resources, physical resources in the hospital to help with some of those stressors, because this time has just been just crazy for all of healthcare, and been a stress on everybody.
Yeah, I can't imagine. I think first and foremost, and probably speaking for the entire CX Nation, just thank you. Thank you for you and for all of your teammates, and just to every single person that's on the front line. It would have been just a completely different level of disaster if we didn't have incredible kick-ass people that were still, because this is the thing people forget in the technology world, me included. Daryl, we've been sitting at home on Zoom chat, sipping our coffee, like taking the dog for walks in between meetings. Healthcare frontline workers have been grinding, they've been kicking ass. They've been, to your point, I can't even imagine, man. Like, I mean, many of our listeners probably have family members that work on the front line, but like going to work every single solitary day, not knowing whether you're going to contract the virus, not knowing whether or not you're going to be in one of the camps that gets extremely sick from this illness, get extremely sick. I mean, everybody knows somebody that's either gotten super ill with COVID, or maybe even someone that's passed, right? Someone that's gone now. So I think that's huge, man. I'd love to jump into the next pillar of tools, because this is interesting for me. Me and you were talking about this a few times recently, but spend a couple minutes talking about tools. I know that there's a million different tools in the healthcare world, Daryl. I get that, but can you
Yeah.
just spend a couple minutes talking about, at a high level, what are some of the major tools for you and for your team that you guys sort of, when you do go to work every day, you rely on those tools help make your job a little bit easier, and more importantly, as we've pushed the healthcare space further and further along, what are some of the big technologies or tools that really kind of you're excited about?
Yeah, so I think, the biggest thing over the last, probably 10, 20 years or so has really been the electronic medical record, right? And so that's something that's really, it's been a push to really standardize everything, across some of these platforms. And there's not just one, right? There's all these different companies that have them.
Yeah.
But the electronic medical record has, one, not only allowed people to read whatever the doctors are writing from, 20, 30 years ago, which has been helpful, but also it just keeps everything on a standardized, template and format, and makes it a lot easier to communicate between, organizations, potentially, even states. I mean, some of these, EMRs, they're called, just, flow throughout the country. And so sometimes you can get records from other places much easier, with easier access, which makes it a lot easier for everybody, right? It makes it easier for us, makes it easier for the patients. And so that's really been the biggest advent of things, I think. We were just talking the other day about, but we also have all these resources available to us, online, and with the internet and everything now. I mean, we used to have these, physician desk reference books, right? These big, thick textbooks that you would have to go and, search page 642 for, look the information that you were going at. Now it's just a click on, online. And so it's been so helpful to have all of these resources. Medicine is changing so quickly, right? I mean, there's so many new studies that are coming out, new drugs, and evidence, and listen, the way that we help to learn, take care of patients, is by publishing some of this stuff, case reports, and things that we find with patients, and people doing research with everything. So that's how we share, gather, and advance our field, right? So it just makes it much easier to get all that stuff and to have access to it, which is just huge in our field, overall.
That is huge, man. I think number one, it's just, I think we hear about this and read about this every single solitary day and every week, about how the evolution of medicine, the evolution of healthcare, the evolution of patient experiences, the evolution of frontline experiences. I guarantee you, Daryl, that after the back end of this pandemic, you are going to have a lot of healthcare workers that probably have some different expectations around what their own healthcare worker experience looks like. The same way that we're
Yep.
thinking about employee experiences on the business side of things, or on the other business side of things. But man, it's got to be huge to be able to, as these things evolve, there's always new technology coming to knock at the door. There's always new learnings and findings coming to knock at the door. So I think it's awesome that you guys are always thinking about how you can push that forward as well.
Yeah, one thing, obviously the pandemic that really pushed things forward, and listen, telehealth was here for many
Sure,
years with
this is
technology and
huge,
everything
right?
else, but
Telemedicine, right, Daryl? It's blown up.
right, but doing this over the phone, right? I mean, listen, this is what we do in the office now, right? And for a period
Are
of
you
time.
seeing patients like this right now, Daryl? Do you have? Is there?
Absolutely, yep. And so I can, I log on to my computer. We have a program that we can actually just chat with them virtually. I can see them, I can see what they look like, I can sort of examine them. Obviously I can't really listen to them with the stethoscope over the phone or computer with
Yeah,
everything,
yeah.
but I can share my screen, I can turn it around, I can show them their scans, I can look over their labs, I can do everything in real time right in front of them, and they don't have to go out. Right now I'm sitting in the Northeast too. Nobody has to go out and brave the snow or the conditions or the
Totally,
ice, or go out.
absolutely.
You reduce your risk of transmission of all these diseases in the setting of a pandemic. So it's been really helpful. And I think the change over the last year has just been the explosion of how quickly that's evolved, right? It was always here. It was always something that we had available. But I think this just threw it into supercharge or super drive, basically just saying, listen, it's really something that we had to pursue. And I think it's here to stay. I think especially when you talk about the access issue to patients, right? right? Obviously, if you're in a big city and you're saturated with providers wherever you go,
Totally.
that's great.
Yep.
If
Yep.
you're sitting in a more rural area and it takes you 45 to an hour to get to somebody, especially if it's more of a routine visit or a follow up or something like that, maybe it's something that you just want to do over the phone in the setting of your home or something like that. And so it makes life a lot easier and really improves that access issue for everyone.
Yep.
And so I think that's been a big thing for us. Moving forward too, I think the advent of some of these electronic medical record and technology. One thing in the ICU world that we're looking at is how do we determine what type of patient or which patient will get worse, right? And so, if we could predict the future, right, we'd be great. We'd
Absolutely.
be millionaires, and everybody would be doing great, and everybody would be
Marty
healthy.
McFly with that sports almanac.
So for us, it's at what point in the hospital stay do we see vital signs deteriorating or labs getting a little bit worse? And technology is there to help us with that, right? We're trying to create kind of algorithms, and there are already algorithms out there that can try and predict which patient is going to get worse, which patient is going to come to the ICU, which patient may have a cardiac arrest or have a really adverse outcome in the hospital. And if we see those things earlier, right, we can try and intervene on those people earlier, right? And so if the light bulb goes up and says, listen, you might want to take another look at this guy, something's not sitting right, we can just put more resources and more eyes on that patient and try and prevent those bad outcomes from happening. So that's really exciting, in our field right now and for the future, I think too.
Totally agree. Daryl, as you and I were chatting about the other day, man, one of the businesses I was at in New York City, Home Team, the idea of leading indicators for potential big health events was a huge part of what we were trying to build. Now, on one hand, the service side of it, we were taking care of these incredible older adults all across the 5 boroughs of New York City and parts of New Jersey. So we did have the home health aid aspect. We were literally there, boots on the ground, day to day, taking care of mom and dad and grandma and grandpa.
Mhm.
Behind the scenes with the technology, a big part of what we were really trying to do was help folks like you and your team see some of these potential leading indicators as, for example, let's say that you start seeing that maybe there's an adverse side effect to a drug that they were just prescribed. And if the HHA could note that in their system early, and we started seeing, hey, mom and dad don't feel good since this is a day 3 or day 4 of that drug, and they're definitely feeling weird,
Mhm.
doctor gets immediately involved, or a pharmacist immediately gets involved. Hey, let's make sure that we've got the right concoction here. Let's make sure that we've given them the right drug. Let's make sure that they're not having one of the bad side effects with that drug. That's one example. The other big ones were falls. I remember in the elder
Mhm.
care space, if you would see 1 or 2 or 3 falls over X period of time, you knew that there was a super high probability for a really bad, really big, really expensive, and super, super painful for not only the patient, but for the family. If say 2 or 3 falls happens in a month, you have a higher probability that a broken hip or a bad knee is about to be on its way. And then
Yep.
maybe that means that your HHA hours need to get bumped up so you have more care, or that make sure that you have people that are taking care of mom and dad or grandma and grandpa to prevent that fall. Or maybe that now is not the time that you can take showers and go do bathroom breaks by yourself. Maybe you do need help. Maybe you're at that point of life where you do need help. And all of those different indicators that we were capturing in our daily care reports, they would be able to get shared back with some of the providers and some of the physicians of you to kind of keep an eye
Yep.
on the patient portfolio and see if anything is maybe kind of a flag or an outlier where you don't like what you're seeing and you kind of want to
Yep.
drill into it a little bit further. So there's going to be more and more and more of this coming.
Yeah, no, it's really interesting to see we have sort of national conferences that we discuss some of these new things and new technologies and everything, and you can see that technology just getting bigger and bigger every year, right? It's just exploding, and the possibilities of what you can do with it. And I think with telehealth getting bigger, we can already monitor people's vitals from home and weights from home and things like that. And they just go right into the electronic medical record, and you can get
Yep.
notified saying, listen,
Yep.
this person's oxygen's going low, they're breathing faster, their weight's up, something's going on with them. I think with as technology evolves and everything happens, I think that's just going to be routine for us, saying, listen,
Yep.
we can monitor these people who are who need that monitoring, like you said, right? Just that are sick or that are higher risk. Just having extra set of eyes or resources to them will really help with some of that.
Big time, big time. Jared, let's just spend a couple of minutes talking about the 36 pillar process. Now, I would say most people, when they think about healthcare, they think about compliance, they think about regulations, they think about rules. Or maybe that's just me because of some of my limited experiences working in the home healthcare technology space. But I'd love for you to spend a couple minutes talking about process, and you can go as deep or as wide as you want in this. But I guess my thought is, I'd love for our listeners, a lot of our CXers or the folks that are on the front lines dealing with customers, phone calls, emails, text message, live chat, all that fun stuff. Process and playbooks becomes a huge part of their day-to-day, because then they can start to formulate some of the answers, and formulate some of the FAQs or the content that's required to give a customer an excellent answer and to oftentimes resolve their issue altogether. Can you spend a few minutes talking about how process works inside of your world, and some of the things that you guys do, whether it's with playbooking or SOPs or whatever you call them, to keep the train on the tracks and to make sure that people know what their parts of the role are on the field?
Sure. So there's multiple layers in the healthcare field, and some I'm sort of more privy to than others. But clearly there's a lot of regulation and process over healthcare, and rightfully so, right? I mean, there are
Totally.
multiple organizations that focus on right, privacy for patients and medical records, and
Yep.
safety in the workplace, and all of these things. And so these are constant constantly oversight in the hospital with everything. And so from an institutional standpoint, right, and anytime essentially one of these either safety events or other things may change, right, if there's some kind of a flag saying, listen, there was a bad outcome or there was a potential safety event, right, that gets looked at, and that they come in, different organizations, whether it be Department of Health or safety institutions, they'll come in and look at that event and say, where are the processes that we can change from an organization or institution to say, to hope that thing won't happen again. Right. And so if there is a fall in the hospital, if there is an adverse event, or somebody took drugs in the hospital or something like that, right, you can look at the processes to say, how did that happen and what can we do to sort of change that. And so that's obviously from a big institutional standpoint, that's key. But just for us too, in terms of our pulmonary critical care section is sort of a smaller portion of the hospital, but everything we do in terms of creating new protocols to take care of somebody. And I think a good example of that is, the COVID-19 pandemic, right? I mean, this was something that, a year and a half ago wasn't on our radar as much, right? But now clearly that, we had to develop processes of how do we intake these patients, how do we isolate them, how do we protect providers, and how do we treat and manage them both
Yep.
in the hospital, before they come in the hospital, and then after care, right? Because a lot of these people, if they're here for days or weeks on end, they're going to come out a lot weaker, a lot sicker than they were at first. And so where do you send these patients? And obviously New York had problems with that, with where do nursing homes, where do you send them to? And you're filled up on all ends. And so we had to create, and it's just been a work in progress over time, this document about all of that information. And it's it goes through a lot of committees, right? There's all sort of different types of committees in the hospital, dealing with obviously both safety is paramount for us, but in the critical care aspect of things. But everybody in every specialty has input on this, because the coronavirus itself can affect anything from kind of head to toe, right? So you could have your brain issues from a cardiac complication, so you need input from all of your other specialties. And so, in creating that process and that document for us, that was something that was really challenging. And, it takes a lot of, nuances and feedback and changes and everything
Absolutely.
else to go through all of those, to create that process itself. Yeah.
Yep. It's funny. I was talking with my mom the other day, and we were I said to her, I said, Mom, do you think when we go back to like full blown traveling, which I know we're all rearing to do,
Oh,
everyone's
dying. Yeah.
I saw there's all these articles this week, Daryl, about how specifically with like Airbnb and VRBO and home sharing platforms, they had one of the biggest surges that they've ever seen in their existence over the last 30 days. Because now that we know vaccinations are under the way, I know that everybody knows somebody right now. Most people's mom and dad, grandpa and grandma, they just got vaccinated. We had
Yep.
frontline
Yep.
workers vaccinated. We got people that have been boots on the ground since day one of the pandemic are vaccinated. Like, we're getting back to normal as quickly as we can, thank God. But I said to my mom, I said, do you think when we travel moving forward, like, do you think masks just become a part of the norm? And if you think about it, like rewind backwards like a year or so, whenever you would travel internationally, it was a very small group of people. When you'd be
Of
walking
course.
through an airport, where it's, oh, you would literally notice people that had
Yep.
a mask, and it would almost stick out because the rest of us were walking around, open faced. And I asked me and my mom were joking around, like, is that a part of like a traveling process moving forward, where that becomes a new norm for all of us, or many of us, I should say many of us, because it's probably going to be something that you'll see a lot of people doing moving forward because of what we just experienced this year.
Yeah, no, of course. And I think, it obviously we can't predict how many people are going to get vaccinated. These variants are something that's certainly, concerning moving forward too. But it's very interesting to see, the influenza that we normally get sort of seasonally has been,
Way down
essentially almost wiped out this
because
year. I
we're all
mean, very,
masked
very
up.
low cases. Yeah. And so it's interesting to hear that, and listen, the flu kills, many people each year too. So the same kind of precautions we're taking for this virus is universal, right? That's what these precautions are for. And so if we can, prevent, additional illnesses or viruses and things like that in the future, and additional deaths, that may be something that's more long-term or potentially long-term, or at least to the point where it's not going to be unusual seeing people masked up, out in public and
Yeah.
as compared to where, like you said, you kind of noticed that before. It may just be sort of a normal going forward that this you can or can't do it. So yeah.
Daryl, I'd love to move into the fourth and the final CX pillar of feedback. And I know that you and I were excited about talking about some of the incredible ways that healthcare of all industries has done an excellent job of not only collecting patient feedback or healthcare frontline worker feedback. Once you collect it, then how do you assess it? How do you rinse it, wash it, understand what to make sense of it, and then what do you do with it? Dive into it. Spend a couple minutes talking about some of the things that you've seen in the healthcare space that have been super, super helpful from a feedback perspective.
Of course, yeah, yeah. There's a lot of feedback in our line of work, and so I think the first thing that really struck me getting into medicine was that listen, in training and residency and fellowship and as a student and all these things, right? You expect that kind of feedback, right? That's your training period. That's your time to learn, to build, to grow, to do all those things, and so that's kind of was expected for me, and that was fine. What I found different was when I became sort of the attending or kind of the sort of the boss, so to speak. The feedback that I would get at that point was sort of eye-opening to me. And so, just because you're the boss, I was kind of thinking, listen, I'm the attending, I could be kind of master my domain, so to speak, right? To use one of those phrases. But it's still a team, right? It's still a collaboration. It's still everybody working together. And so where I work, I mean, we get feedback from everyone, right? And it goes into our evaluations, right? And so I meet with my supervisors, at least once a year. And when I first started, listen, I had some issues, I had some trouble. I was meeting with them more often and learning the ropes, so to speak, with everything.
Sure.
So we get feedback, from every part of that team that I mentioned earlier. And if we have those interpersonal problems or relationships, now listen, a couple times, in a stressful environment, that's one thing. But if you're consistently having problems or issues, and you need to sort of have some behavioral change or some kind of change in the business, that's something different. So so that was something that was really kind of eye-opening to me when I first started. So this feedback happens continuously for us, right? From the inpatient world, the outpatient world, in our outpatient office with everything. It's the same thing. Both our colleagues, our front office staff, the nurses, everybody gets input on this, and we look at that stuff. And so that was something that was interesting for me. And listen, even the people that we train right now that I'm training sort of residents and fellows and everybody else, and we get feedback from them too directly, right? How good of an educator was I? A teacher was I? How good do I run rounds? Do I do these things? So we get feedback continuously like that all the time. So that was the one aspect of it. But I think the big thing that really equates to the business model is that the patient or customer feedback, is really huge, and it has been for a long time, right? And so, really, everybody that comes into the hospital and everybody that comes into the office, I mean, they all get, especially with the advent of technology and everything else, we send them a survey, right? We send them a survey. How was your experience today? And so, some of these can be pretty long and tedious, right? If they want to get into it.
Absolutely.
But it's everything, right? And so when they're in the hospital, for instance, it's was the room clean, right? Was the noise down, right? Was it loud? How was the environment, right? So that's one part of it. And then how was the service, right? Were you treated nicely? Did they did they ignore you? Did they explain things? Did they bring in your family and everything else there? but they can really have feedback on, how is the food at the hospital, during that time. And all that goes into the patient experience with everything. So that's absolutely huge for us. And so, and listen, we look at that feedback and we use that to grow and get better on both sides of the equation, right? And so on the sort of outpatient side of things, we go over these things, every quarterly, something like that. We'll go over them and look at all these comments that everybody makes, and look at them and see where are areas that we can improve or get better, both from a personal standpoint, right? If there was a personal problem with anybody, or a professional standpoint, an institution standpoint, right? How is the flow of the building, right? How is the, how do the patients feel when they left, the checkout process, the check-in process, the rooming process? Yep. All of these things take into account, how these patients experience us and view us. And we want to provide obviously the best experience that we can, because, we were talking about before, patients can go elsewhere, right? And so if you don't have a good, if you don't have a good rapport with somebody, if you don't have, a good buy-in from the patients and a good understanding of things, they're going to go somewhere else, right? And so that could be good or bad, for both them and us. And so, I think we do a great job, and I want patients to come and see us, and I think we can get them better in that. But they have options, right? And so you don't have to. They're not stuck with us, not stuck with anybody. So they can go different doctor, different healthcare system, different hospital. And so when you have those options available, you want to keep them coming back. You want to develop that relationship so you can have a good long-term build with them and be able to help them.
100%, Daryl. I couldn't agree more. I know, on a personal note, thank God, I've been able to stay out of the hospital most of my life. As Daryl knows very well, guys, my wife and I, we just had our firstborn daughter, and Daryl, everything that you just explained, it's funny. Ash and I, after we went through the process, all of those different variables that you laid out, was the room nice? We had these incredible nurses that took it. We had like a kick-ass team. So we got really, really lucky the couple of days we were there. Even the food, though, you bring up an excellent point. You laugh about the food, but we were there for 3 days. So that we did have to depend on, the hospital's food service. And that was, awesome as well. But it's funny, we had a really great experience. And sure enough, we did get some of their feedback requests. Obviously, me being in the business I'm in, naturally we took care of that right away and sent that back to them. And
of course,
all of the reasons why me and Ash had such an awesome experience with our first child there. So I think it's super important. The other thing that it makes me think about, Daryl, is in the healthcare space, it's really interesting. We had an individual, Garrett Smith, on the show probably about a year ago, and Garrett's business was called Rep Checkup. And essentially what they were doing was they were helping physicians and specialists across the US understanding the power of the review, meaning the patient review. So essentially, if you want to fill up next month's availability, hopefully you got a bunch of 4 or 5-star reviews with a bunch of people talking about how great it was to go visit. So it's interesting. You're going to see some of the same similarities in other industries and other business facets of where the power of the promoter literally can be your biggest fuel for business development, growth, and scalability. And you just said the exact same thing right there, man, which it's like these health organizations are investing and thinking about exactly what they're doing excellent and what they're not doing so great, so that they can literally keep these patients and customers and their families coming back through the door again and again and again.
Absolutely. I mean, you have to, from a healthcare standpoint, you have to get those patients, and you have to take care of them and take care of them appropriately. And that feedback is huge for them, right? It tells them, what are we doing right? What are we doing wrong? What can we work on? What can we build on? Right? Other services, other things there. I think that's absolutely huge.
Yep. Well, look, this has been awesome, Daryl. I'm pumped that you were able to come on, chat with the CX Nation, give us a completely different world to think about. And now we're going to have a bunch of CXers thinking about how they can convert some of the things that you guys are doing with patient experience into their customer experiences. So, number one, thank you so much for joining and sharing your story.
Of course, thank you. Yeah.
Before we wrap up, Daryl, is there any other features or highlights or things that you want to know? Or lastly, where people can get in touch with you if they want to keep the conversation moving forward, if there's something that you said today that really struck a chord and they want to learn more about it?
Sure. Yeah, I'm happy to chat. I'll provide my email address to you guys there. Maybe I can throw it up on the website, the podcast with
100%.
everything down there. I'll send
Yep.
that over to you. Healthcare, like we talked about, it's a changing field. It's a business field, and very common similarities to what everybody is listening to there on your side of things as well. And so it was good to come and chat about those things because not that different after all. In terms of
Not at
things, just a
all.
little bit a different kind of model with
Exactly.
different outcome,
Yep.
but same sort of foundation for everything there. And so it was really interesting when we started chatting about it, year ago or so, and I'm glad we could come on here and talk about those things. Yeah.
This is awesome. Dr. Daryl Connolly, thank you so much for joining the CX Chronicles podcast. Let's get a round of golf in, hopefully very, very soon.
Can't wait. That'd be great.
All right, Daryl, have a great day, man.
All right. Thanks, Adrian. Take it easy.